a bystander, what you need to know to make you a first responder, not just a first responder, an effective first responder, because it's one thing to know the knowledge and another thing to want to use it. So I'm going to put that in Dr. A, B, C, D, and G.
Dr. A, B, C?
Yes.
Oh, wow.
Dr.
So
A, B, C, D, and G.
Okay.
Is an acronym.
Okay.
D is danger.
Okay.
You need to be able to assess the danger area, because don't forget, every victim only has between 0 to 3 minutes. That is your spot. That is your time. From 4 minutes, we're already looking at brain dead. So we need to move as fast as possible. And that means you have to do all these things within that time. You need to be able to assess the danger. If it's like a building collapse, a fire, you need to check. If it's a road traffic, you need to look left, look right, look left again to be sure that there's no upcoming vehicle, because one victim is always better than two. You need to be safe for you to be able to save someone. So assess the danger, which is the D, and then the R is response. You need to be able to check the responsiveness of the victim, and that you can do by checking the pulse. You can tilt the head just to be sure that air is passing. And if the person is wearing tight clothing, you just loosen it. And just to be sure that...
Like a tie, you can loosen the tie.
Yes, a shirt, you want to open the button. And then you need to call the person, please tap, scream for help. You need to scream for help.
So let's say if it's Pascal, for instance. Pascal.
No, that is if you know the name.
Okay, don't look at me. It's just an example. Yeah, but you have to. So if you don't know them, what do you do?
Hey, excuse me, sir. Excuse me, sir. Excuse me, ma. Can I help you? My name is. It's just to create that awareness, because they don't just. It's not like they died at a spot. Okay. There is that you want to make sure that they are sure someone wants to touch me. Okay. Consciousness. You need to be able to get their permission.
So D, doctor. The first doctor
is
A,
danger.
Is danger.
D is danger. Okay. R is responsiveness.
So you assess your environment to be sure there's no danger to you, to the person, before you now
check for the person's response.
You go on your knees?
Yes, please.
Okay.
If the person is on a chair, please, you need to bring the person to the floor.
All right.
Yes.
Lying down their back.
Yes, please.
I think there's something called a response position.
Recovery position. That's at the end.
Okay.
You need to be able to have saved the person for you to do that.
Okay.
So then there is the R, responsiveness. There are different kinds of responsiveness, which I the time constraint. So there's always, if you want to know more about it. So then there's the A, airway. You need to be able to check if the person is breathing, because CPR must not be performed on someone that has a pulse, that is breathing and is conscious.
Oh, if you feel a pulse, don't do CPR.
Don't do. If the person is conscious, if the person is responsive. CPR simply means cardiopulmonary resuscitation.
Yeah, you see, you always went where I went to.
The heart, the lungs, and make alive.
Okay, so D, danger. Check around you if there's danger.
Yes.
R, response.
Yes.
Have the person call the MC, they're responsive.
Yes. A, airway. Check if the person's breathing. And then B, A is airway.
How do you do that?
You can put your hand towards the person's nose to check. Once you open, you can check. So A and B kind of like linked. That's airway and breathing. Okay. So for the breathing, you check, is the chest rising and falling? Is the abdomen rising? You need to be very sure. You need to check the pulse. And please do not use your thumb while checking for a pulse, because your thumb in itself has its own pulse. So by the time you use your thumb, you might be feeling yours.
So what do you use?
Yes, your two index. Okay. So you might be feeling your own pulse while you're thinking you're feeling the other person's pulse. So you need to be able to be sure about that. And if you are still not convinced, look at the chest rise and fall for like 7 seconds. Okay. Yes. To be absolutely sure, because once you start CPR, you are saying, okay, this person is not breathing, is not responsive, the heart has stopped, I want to restart the heart.
Means you really need to get your emotions in check so you don't panic, because that 7 seconds, you see somebody down, you may panic. So
the first rule is, no matter the situation, do not panic, because it's also bad for your own health.
I see.
You could come down with anxiety disorder.
I see.
So do not panic. That is not when to scream all the negative things. Do not pass your fear to the victim. Whatever you do, always reassure the victim.
Okay.
You're fine. I'm here. I'll be with you. I'm not leaving you. I've called emergency number. Someone is going to be here soon. But till then, I'm here with you. We go through this together. I'm not leaving you behind.
See, even hearing her say that alone is making me calm already. The way she's saying it. Okay, so we've done A, B.
R, A, B. C is circulation.
Okay.
Circulation comes, you can either use circulation or compression. So by the time you're sure that this person is not breathing, has no pulse, is unconscious, and you've called your 767, you've if there are persons, scream for help. At
what point do you call 767 or 112?
Before, once someone is going down, and you know that it is not a theatric, it's not a function where someone can just fall that way, or if you see a fire, a building collapse or a fire burning, please call 767 immediately.
So even before you start doing anything,
yes,
first things to call.
Yes, especially if you are alone, because handling emergency takes a circle of persons. So that's why we say let's build a team of first responders across every community, because if I need to attend to someone on the bigger side, I would need someone that has more body than me to help. If I need to, if it's like a building collapse, I might need someone down there to be able to also check a second bird eye view for me. I'll need someone to help me. And CPR can be very exhausting. It is very exhausting.
So call that number.
Yes. So it helps them come on time. And yes, it shows your location if you have that. But in case you don't, please do not hang up on the emergency number.
Okay.
You have to be able, one of the qualities of a first responder is to be able to give accurate information. You need to be able to tell them, hi, my name is Abigail. There's a victim at road 112. Can you come down? I want you to come because I met this person like this. Because when they come, you need to be able to also give them your location if your location is not showing for them. And by the time they come, you would want to let them know the situation you met the person and what you have done. For example, if it's like a bleeding case, you've tied a tourniquet, you need to let them know. So by the time they are getting to the hospital, medical doctors
tied
need
a what?
to know. A tourniquet. Okay, even if you don't know what a tourniquet is, you could use a piece of clothing.
Are we going to get to that point in this ABCDE?
Oh well, okay, when you come in.
Let's conclude.
Okay, so the C is circulation or compression. Okay. So it's either the person is breathing or you have to compress. That is if there is no sign of activity. So it means you want to restart the heart. And once you're doing that, what you're telling yourself is, this is it. This person has to make it. So your hands must be very straight. It's not like you're grinding pepper. So
the person is on the floor?
Yes.
Okay.
And please stay at the left-hand side of the person because that is where the heart is.
So you go on your knees?
Yes, please. Okay. Please stay at the left-hand side. Here. Yes.
So if you were performing it on me, you'll be here?
Yes.
Okay. And then you go on your knees?
Yes. Okay. Yes, just beside the person. It makes it easier. Okay. However, where you have a helper, the person can be at the right. Okay. So, because if you're tired and you need to lift up your hand switch, the person would have to come in immediately.
So, be on my right?
Yes.
By my
it's
side?
Allowed, yes.
Okay, the side of the person administering the CPR. The helper will be on my side.
Yes.
So I can move and the person now continues.
No, it's not like you move. You could just... you're tired, you want to switch your hand, it means you're lifting up your hand for the person to place his hand so just right there.
Let me see the
please, you need the heel of your hand. Yes, the heel.
That's the hard part.
Yes, that's the heel. And then you need to put place your dominant hand.
So
you need to place your dominant hand on the hand.
Wait, which one is under? The dominant hand?
No, the dominant hand is up.
Up, okay.
Because
so if you're lefty,
yeah,
your left hand will be on top.
Yes, please.
If you're righty, your right hand will be on top.
Should be on top, yes. And make it very straight. It has to be straight.
Your hand will be like this.
Yes.
So you slide the fingers in between each other.
Yes.
Okay,
please.
and then you bend it, close
it. It depends on you. I might even forget to do it, but all you need is the heel.
It's the pressure. Okay,
yes.
Over here. Okay.
And then, please, you're not grinding pepper. I know. Please don't grind pepper.
Abigail.
And don't move too fast, nor too slow. Because what happens is, if it's too fast, you're not giving the heart the opportunity to send the blood to the brain. Before it goes, you're bringing it down.
Okay, so let's talk about the strength.
Okay.
How heavy should it? Is it, or is it, I mean, how heavy should your pressing be?
When you're pressing, because now we have adult, child, and infant.
Okay.
The way you do for an infant is this: just 2 fingers, your 2 index fingers.
To press.
Yes, please. And you do not press too far.
Oh, so you don't use the heel?
No.
Okay.
For an infant 0 to 1, you don't press too deep because their body is yet to be fully formed.
Okay.
If you do that, you might as well just
So it's 2
rupture.
fingers?
Yes, please.
Your index finger and middle finger.
Yes.
And then you place it
Just right
okay.
the chest.
In the middle.
Yes, please.
Oh, okay.
And just gently. And if you want
So
to
do you this way or
No.
press it down
Yes,
like
you're
that?
not choking.
Okay.
And if you are giving them
Yes,
rescue
yes.
breath, please do not
Don't
not blow. You
Okay.
could burst their lungs.
Okay, so we're still talking about the pressing down.
Yes.
So for an infant, 0 to 1, 2 fingers.
Yes.
With the tip of the finger,
Yes,
press
please.
slightly.
Yes.
Okay, then for who else? What shall I age range?
For a child,
Okay.
1 hand is
Age
fine.
what to what?
From 1
To maybe.
to maybe it also depends on the body size.
Okay.
If a child is let's say 10, 11, 12
Yeah.
and has a very massive development
All right.
with broad shoulders, you might want to do the 2. So
Okay.
you'd also have to be
That's it. The full one.
yes, please. And then for an adult is the full one.
Okay.
And please, the depth of the push is not
It's not a fight. It's not an in-depth boss giver. I'll say.
yes, and it's also not a rubbing on the chest
It
because
must-
you need to go as deep as
For the children, we still use this. Or
that
this?
is based. No, for children is
It's one
this.
hand.
Yes, one
Okay. Can you
hand
press it down? Sorry, on your chest. Let's see.
on my
Yes,
chest.
just a little. No, not just the position.
Oh,
Okay.
okay. So this
Okay.
is
Okay. On your
when you
left
talk
side.
about the heart. This
Okay,
is your heart.
Okay. So you can now put it on the table and show us the. Okay.
Okay, so I'm going to stand so you'd be able to
Yeah.
see
Yeah. Go on. Yeah.
just what I'm. Yeah.
Okay. Can you turn and face this camera? Yes.
Okay.
Thank you.
Yeah.
Uh huh.
Because from here down has to be very straight. I'm not doing like this.
Okay.
I'm not doing like
This
this.
for a child
Yes. It has to be very straight.
Okay.
Your hand has to be straight.
on the heart.
Yes.
Okay, which is just above or under the left breast.
Yes, under the left
Okay.
breast.
All right. So it's yeah.
Under the left breast. But for an adult, it has to be your 2 hands rather, still on the same position. However, it still has to be straight. So whatever you're doing, it means you're not doing like this. You're not doing like this. And you're not doing like this.
Okay. Those who are listening will need you to explain what you're saying.
Explain.
No. Yeah. You keep demonstrating, but you describe it.
Okay. So as
So you're not bending your elbows.
no, you're not bending your
It's
elbow.
straight.
It has to be very straight.
Straight.
Yes, because the strength
when you're
comes
marching,
from
straight,
yes. The strength comes from the shoulders down
Okay.
to the hand.
So do it again. Let's see. Keep your hand
Okay.
straight and
Keep your hand straight and push in
the heel of the hand.
the heel of your hand because if you use the middle, it's not going to be getting
Okay.
the result you want.
Give us the timing.
Of the move,
Yes.
okay, if you can do. And also, one of the things you have to learn is learn to know your breathing.
Okay.
Not when your breathing is too fast, not when it's too slow. So it helps you as a person to also learn to know when something is wrong with you as a person.
Okay.
How is your breathing? How is your pulse rate? By the time you are able to understand your own breathing cycle, it will help you when you are compressing on someone.
Okay. Okay.
It will help you.
But give us the timing again.
It's like tick, 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 not tick, 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 tick,
Just
tick, tick,
just
tick.
like a clock.
Yes.
Seconds. Okay. All right.
Drop of water.
Wow. Let's put our hands together for Abigail. Yeah. Okay.
And then there's a D.
Okay. Yeah,
That's
D.
it's not common. I always advocate for if we can get to that point where we have it in public places, the defibrillator. That's
Okay.
AED,
Okay.
automated external
At what point do you
defibrillator.
blow?
Yes, mouth to mouth.
Is it after 5 pressings? Or?
Piece of life. I know that as of 2020, WHO came about with hands-only CPR is effective
Almost
to ensure that persons you do not take on illnesses, sicknesses that's not yours.
So hand alone is effective.
It's effective.
All right.
However, if you have mouth covering or a family member, your spouse, your child, and you're comfortable with, after 30 cycle, you breathe in and breathe into the person.
Your mouth. You have to close your nose.
If you have a mouth covering, it will do that for you already.
Okay, you don't need to close your nose.
Yes, but if you don't, you can close it.
So people, they're telling you, don't pour pure water on anybody who is
Please
collapsed. Don't pour pure water on their face and shake them. Wake up, no, and hit them, slap them. No, this is what you do. Pascal, we have to go. Just a final word, a sentence.
Yes,
We have 1 minute.
We